Hi, I'm Vic Rice, Vice President of Marketing and Consumer Insights. Our coworkers shared that taking a closer look at our practices, policies, and processes with a DEI lens would be beneficial in helping us highlight areas for improvement and increase transparency. As a proud member of the Executive Diversity, Equity, and Inclusion Council, I am happy to report that we are committed to adopting this approach and are taking steps towards major progress. Our Human Resources Group frequently engages in benchmarking with similar organizations to ensure our processes, policies, and practices are in line with industry standards, as well as being fair, consistent, and relevant. The employee resources groups are actively inserting their voice into the conversation about policies and procedures. In fact, we have received suggestions regarding policies that should be considered, as well as updates to existing policies. These will be evaluated and shared with leadership for consideration. There is a time and place for diversity, equity, and inclusion at UNC Health. It's all of the time and everywhere. I will now turn it over to my Executive DEI Council partner, Laura Easton, President and CEO of UNC Health Caldwell. Laura?
Hi, I'm Laura Easton. I'm the President and CEO at Caldwell UNC Healthcare here in the western part of North Carolina, and I'm a member of the Council for Diversity, Equity, and Inclusion at UNC Health. Several weeks ago, we did a survey of our employees and we held a Space for You forum and received some really great feedback. And our coworkers suggested that we take a look at our practices, policies, and procedures as it relates to diversity, equity, and inclusion. Our Human Resources Department historically has looked very carefully at our policies and practices and used benchmarks to compare with data and statistics our performance. Additionally, we have employee resource groups that have formed where we can get specific input from groups of employees and coworkers about how we are practicing as an institution. When I saw this feedback from our employees, I was reminded of a study grant that I received several years ago from the Duke Endowment to look at how we can bring men into nursing and at a higher rate. And when we did that project, we brought together a group of male nurses in our organization. We asked them how we could make it a more open environment for men in nursing. They very quickly informed me that we did not have bathrooms on the nursing units for men, and that I should go look at what was happening on the nursing units as it related to bathrooms. So I did. I went to the nursing units, I went into the bathroom area, and from a visual perspective, it became very clear very quickly that this was a space for women and not a space for men, or definitely not a space where men would feel comfortable and welcome. And that was a very enlightening experience for me. And it showed me that many times our practices, our policies, and our processes in reality are very different than what we expect or desire. And that if we can come together and listen very closely to one another, we can really create a better, more inclusive environment that will allow us to enrich and enhance our workforce. So as a member of the Diversity, Equity, and Inclusion Council, I'm very much looking forward to working in this area to make sure that across the entire UNC Health, that we have an environment for our coworkers that is welcoming and respectful.